We've been listening to the White House press briefing there, hit a number of topics, most notably, or among the notable topics, we heard about the president's medical condition, with the White House press secretary there saying that he was evaluated by the White House medical unit after questions and after the president noticed some swelling in his legs. And they said in an effort of transparency that tests were performed. I want you to just listen to the sound here.
Speculating about bruising on the president's hand and also swelling in the president's legs. So in the effort of transparency, the president wanted me to share a note from his physician with all of you today. In recent weeks, President Trump noted mild swelling in his lower legs. In keeping with routine medical care and out of an abundance of caution, this concern was thoroughly evaluated by the White House medical unit. The president underwent a comprehensive examination, including diagnostic vascular studies. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70. Importantly, there was no evidence of deep vein thrombosis or arterial disease. Laboratory testing included a complete blood count, comprehensive metabolic panel, coagulation profile, D-dimer, B-type natriuretic peptide, and cardiac biomarkers. All results were within normal limits. An echocardiogram was also performed and confirmed normal cardiac structure and function. No signs of heart failure, renal impairment, or systemic illness were identified. Additionally, recent photos of the president have shown minor bruising on the back of his hand. This is consistent with minor soft tissue irritation from frequent handshaking and the use of aspirin, which is taken as part of a standard cardiovascular prevention regimen. This is a well-known and benign side effect of aspirin therapy. And the president remains in excellent health, which I think all of you witness on a daily basis here.
All right, let's bring in emergency physician Dr. Jeremy Faust to talk a little bit about what we are hearing there. Doctor, take us through this, because it's really two things that we're hearing: chronic venous insufficiency, AB9, I think I heard her say, when it came to the swollen ankles that had been observed. And then also she's saying bruising on the back of the hand due to aspirin regimen combined with a lot of handshaking. Take us through this.
Thanks. Yeah, thanks for having me. First thing, I think that we're just hearing a lot of medical jargon, such that even you're just mentioning AB9. I think you're hearing her just saying a benign condition. Oh, a benign condition is what is
a benign and common condition,
which is great, right? But it's always good to unpack all of these terms. So what happened here was good medical care so far, and it's basically not alarming information, and it's not surprising. The president is an older man. I believe he just turned 79 years old. He has had risk factors for this condition that they're talking about, which is called chronic venous insufficiency. And what that really means is that the blood that goes out of the heart has to return to the heart through the veins. And as we age, some of that blood flow back to the heart, that's called venous return, just slows down in some patients more than others. And that can lead to things like swelling. That can look like things that many people would be familiar with, like varicose veins. So this is a pretty normal part of aging, and especially for someone in the overweight to obese category, which is where the president has always been. And but the bigger concern, which was addressed in that information that we just heard about, is that symptoms like this do need to be evaluated for more serious conditions, and that is what happened.
And I want to bring in cardiologist Dr. Bernard Ashby as well to this conversation, because to Dr. Faust's point, as the White House press secretary laid out, there was no evidence of deep vein thrombosis or arterial disease in what they laid out, even with this diagnosis of chronic venous insufficiency. Can you just break down what the concern may have been or would have been if there was deep vein thrombosis, and why the need to make that distinction was necessary? We might be having some audio issues, but Dr. Faust, can if you're still on the line, Can I just pose that same question to you, just about the deep vein thrombosis and why that distinction is necessary?
Yeah, this is the important thing. When people have symptoms, they want to get looked at to find out if there's a danger, or whether it's a relatively less dangerous, benign condition that's just causing some discomfort. And as stated, a deep vein thrombosis is what the concern would be. That is an abnormal blood clot. Our blood is always on this balance between how thick and thin it should be, and we have amazing bodies that keep our blood in a really narrow range of how thin or thick it should be for our own safety. Too thin, you bleed too much. Too thick, you make clots, which blocks off blood supply to vital organs. And so when you have, if your blood is a little too thick or a little too slow in terms of getting back to the heart, which is this condition that the president does have, these blood clots can start to accumulate in places where they're not supposed to, or get too large to be safe. And the concern there would be, when that blood clot occurs, that it can actually then break off of the vessel where it's forming, usually in the legs, and travel up back to the heart. And then when it gets pumped back out, it can cut off blood supply chiefly to the lungs, but it can also go other places depending on individuals' anatomy and abnormalities. But these dangerous blood clots, they can be very dangerous. Some people can get these conditions diagnosed. They're called pulmonary embolisms in the lungs, blood clots of the lungs, and they can be benign and they can be treated. But some of them can be life-threatening. So it's an amazing spectrum of illness that we diagnose in ERs, where people have these blood clots, and the treatment can really vary from blood thinners by mouth or IV. But in serious life-threatening cases, some of these blood clots need to be removed actually in medical procedures, or we need to give medications that break those clots apart. So it's a spectrum of disease that can go from mild to life-threatening, and that is why the president was evaluated, to see if he had that condition, a blood clot, and fortunately he did not.
Yeah, really good context there. And Dr. Ashby, as you're listening to what we're hearing from the White House here, they're describing this as benign, right? As something that isn't harmful to the president at this point in time. But let's take a look at his lifestyle, because he obviously has a very demanding travel schedule at times. We know that that can certainly cause risk factors to circulation. There is his age. There is his history of, certainly he does play quite a lot of golf, but he doesn't have a history of really intensive cardiovascular activity. How do all of these things work together, and what kind of treatment or management might a doctor be looking at over time for someone of this age who is traveling a lot and sitting a lot?
Yeah, so it appears that the White House physicians were also concerned about more than meets the eye, meaning that they did a number of tests that I overheard you say, or the edit say earlier. He had a echocardiogram, a BNP, which is a brain natriuretic peptide, and lower extremity ultrasounds. So essentially, they were covering all their bases, meaning that they were screening him for heart failure, which is a common cause of lower extremity swelling. In addition to that, they were concerned with increased pressure in his heart. So they did an echocardiogram and a BNP. And if those were abnormal, then you would be concerned with heart failure. So looking at the president's lower extremities or his legs, he had bilateral swelling. So it's less likely that's related to a clot in the vein, and more likely related to things like heart failure, kidney failure, which are things that they alluded to and said that that was not the case. Now taking a step back, looking at the entire case, the president is obese. He is older, and I don't know if he has hypertension, but that's very likely or very common in his age group, particularly with his body habitus. So when you do have a condition like lower extremity swelling, bilateral, and a diagnosis of venous insufficiency, the question is it intrinsic to the veins? Meaning, does the venous insufficiency that he has, is it related to bad valves, or is it related to increased pressure coming from the heart? And those can be related to things like weight, also things like sleep apnea, which he fits the kind of the prerequisite for, meaning that he's a big guy, he's obese, and more likely to have sleep apnea, which is a condition where you stop breathing at night. And that can also increase the pressure in the lungs, which can then cause a backflow to the body, and it can be seen as lower extremity swelling, or what you saw in the picture. So again, even though he's diagnosed with a benign condition, but venous insufficiency by itself doesn't necessarily mean it's benign. The question is what's causing the venous insufficiency. And so I would want to know whether or not he has any evidence of, again, increased pressures in the heart or increased pressures in the lungs, which can be contributing to that. And if so, what is the primary cause of that? Is it sleep apnea? Is it heart failure? But again, this is all speculation. But I wouldn't take the benign diagnosis on his face. I would want to work him up a little bit more to figure out exactly why he has venous insufficiency.
And the White House said they would send through some more details from what was announced in the press conference. So we'll look for a lot of the details that you just gave us a good heads up to look for. That's why we bring in a cardiologist. Dr. Ashby and Dr. Faust, thank you both for being with us.
ধন্য বিশ্বকৰ্মা শতবাৰ প্ৰশংসিছো মই তোমাহেন শ্ৰেষ্ঠ শিল্পী পালো আমি দেৱ সমাজত তোমাৰ হাতেৰে গহাই অমৰাৱতীপুৰ জিলিকিব চিৰদিন স্মৃতি চিহ্ন হৈ তোমাৰ এই জয় গান গায় জয় বিশ্বকৰ্মা জয় বিশ্বকৰ্মা জয় দেৱৰাজেন্দ্ৰ জয় 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 দেৱগণ বলা আমি নিজ নিজ কৰ্তব্যত হওঁ অগ্ৰসৰ করুণা ময়রা করুণা করিও কৃপা দেবগণৰ জয় হওক দেৱৰ্ষীৰ পদধূলা পাই ধন্য হ'ল আজি মোৰ অমৰাৱতীপুৰ বাৰু কওকচোন দেৱৰ্ষী আছে জানো কিবা নতুন সংবাদ বাসৱ বৰ্তমান নাই তেনে বাতৰি বিশেষ কিন্তু ভৱিষ্যত এটি বুটলি পানী আনিছো মই মৰতৰ পৰা আদি দত্ত হিৰণ্যকশিপুৰ আৰু তাৰে সহোদৰ ভাতৃ হিৰণ্যকশিপুৰে আতংক কৰিছে সূচনা প্ৰলয়ৰ ভীষণ হুংকাৰে গৰ্জন কৰিব লাগিছে তয়ো বিশ্ব জয় বুলি আৰু দানৱৰ উত্ৰাপত থৰ হৰিকম্পমান হৈ বসুমতী আজি আহলি বাহলি দেৱৰ্ষী দানৱৰ নিষ্ফল গৰ্জনত হ'ব জানো কিবা দেৱতাৰ অপকাৰ অপকাৰ এই দেৱতাৰ অপকাৰ হাঁহি উঠা শুনি যাব পাৰি বাৰু তুমিয়ে কোৱাচোন সহস্ৰ লোচন বিশ্ব জয় হয় যদি দুয়ো দত্ত বীৰ ৰব জানো অমৰাৱতী ভিন্ন ৰূপ লৈ শুনা পুৰন্দৰ আৰু যত মানে আছে আমাৰ মন্দিৰ যক্ষ দক্ষ আকাশ পাতাল সকলোকে লক্ষ্য কৰি অচিৰেই আহিব দত্ত বীৰ প্ৰলয়ৰ হুংকাৰে গতিকে অবিলম্বে কৰা প্ৰতিকাৰ নতু ধ্বংস হ'ব অমৰাৱতীপুৰ ধ্বংস হ'ব দেৱ ভৈৰৱ সুন্দৰা এটি পলকতে নৰৰে শুনা শুনা পুৰন্দৰ মুখ ৰব ঈশানা প্ৰলয় হুংকাৰে আহে কোন পুৰন্দৰ উপায়